like anything else in your body. You know, if your hand bled every time you used it, you'd probably figure there was something up. It's the same thing. Your mouth is telling you that that's not good. You do not want that happening. There's some process in your mouth that's starting to break down the gums and also breaking down the bone underneath those. And that's one of the main symptoms. Also, I mean, loose teeth is a huge one too, because as that disease progresses, there's less support structure for those teeth, so they can actually start to get loose. And you've heard people refer to, being long in the tooth. Eventually the gums start to actually shrink down and you get the teeth looking longer and longer as well. When you also, if you bite down and you can feel, pain, or just like, you can feel your teeth, it just feels off, then, that's your body telling you that there's just something not quite right going on in your mouth. And, it's best to get it checked out to make sure that, you don't have something serious going on, because, we've got a lot of patients that have pushed this off for 2 years now, basically, just because, COVID's been around. It's definitely a thing, and a lot of people are fearful about it. But it's not something you really should push off, because it only gets worse with time. It just progresses and gets worse and worse. And eventually, I mean, periodontal disease is one of the main reasons that people lose their teeth. So it's not something that you want to push off, because, nobody wants to lose their teeth, because then they'll end up having to get implants, and that's great and all, but it's, again, we're periodontists. We're supposed to save teeth as our primary mission, our primary goal. We've kind of built our practice around that goal to try to save smiles here. And it's something we're fantastic at. It's something we've been able to really be very successful at. We can save a lot of teeth that, a lot of people would just end up, taking them out, giving you either bridges or dentures, things like that. But we're able to save a lot of these teeth, and, we do it daily.